Hi, I'm Dr. Broussard with the Waggin Trained Veterinary Clinic, and in today's segment we're going to discuss diagnostic imaging in cats. My assistant Cole and I put together a list of commonly asked questions that we're going to run through, and that will hopefully give you a better understanding of diagnostic imaging in cats. Cole?
Dr. Broussard, what is cat diagnostic imaging?
Well, diagnostic imaging is the use of images, I'm not being silly, to help you diagnose a disease process or an injury or anything like that in a cat. So what does that mean? What kind of image? Am I taking a Polaroid picture of the cat? No, of course not. We are talking about things like ultrasound, x-rays, and if we really need to, MRI, CT scan, those kind of things. But yeah, it's to help us get more information to properly diagnose a condition.
How does the use of diagnostic imaging help to determine health issues in my cat?
Well, that's a hard question to answer because it depends on what the illness going on with your cat is. Diagnostic imaging can be used for so many different things. For example, broken bone. What are we going to do for a broken bone? X-rays. We don't need to do MRI, CT. We don't need to certainly do ultrasound. Bones show up very well, very vividly on X-rays, and most every veterinarian has them. So to answer your question in relation to that, done. I mean, there's your answer. You can do it, see a broken bone. Now you know that's the problem. How do I fix it? Is it certain? It determines, it confirms the source of the problem, how bad it is, the extent of it, what the treatment options are, and then you can make a better, more educated decision on how to move forward. Flip side, what if it's not a broken bone? What if you're suspecting that there's cancer in the intestinal tract or something like that? That's real tricky to diagnose. X-rays might do it if there's a mass that can be seen, but even then, it's a lot of gray area in there, so maybe, okay, I think I see something suspicious. Let's go ahead and do ultrasound just to confirm it. And then you're using two forms of diagnostic imaging to hopefully better give you an answer. And sometimes even after that, there's still some gray areas, maybe still some unanswered questions. And then oftentimes we will, because most veterinarians don't have MRI capability or even CT for that matter, so oftentimes those cases may need to be referred to larger, maybe referral type centers or teaching hospitals that can do some of those advanced modalities for us there.
What are some possible conditions that are diagnosed using cat x-rays?
So x-rays, as I mentioned, broken bones is probably the first and most obvious thing that you would think of. I also kind of mentioned cancerous tumors, if you will. That can be done. We do use dental x-rays a lot. That's a part of diagnostic imaging that slips through the cracks sometimes. But if you're doing dentistries in cats, we have dental x-rays that can tell us the health and viability of teeth that oftentimes you cannot know without the help of imaging. Intestinal problems as well, obstructions, any kind of bowel obstructions, things like that. Stones in the bladder is another very, very good one that you unfortunately see on cats somewhat frequently. All of those things would be very important and very, maybe not very obvious, but potentially obvious on x-rays.
How will a veterinarian decide that a cat needs diagnostic imaging?
Yeah, depending on how they present, again, and I'm not trying to be vague, but if they come in with a leg that's going the wrong direction, they might need an x-ray. If they come in with a palpable tumor in their abdomen, they might need x-ray or ultrasound. It just depends on how they present. Keep in mind, guys, our patients can't talk to us, so cats come in, they might tell you they're hurting because of their clinical signs or their vocalizations, but they can't talk to us. They can't tell you, hey, I stepped here and something popped. We don't know. So we got to start looking. And that's why I know people get frustrated when we always talk about we need to do blood work and urine and x-rays and that. But we don't know if we don't do those tests. They don't talk to us. So we have to use what we can and what's at our disposal to try to give an answer, and so our treatments can be much more effective.
Why is early detection and diagnosis of internal injury to your cat so important?
Early detection and diagnosis of any problem is always important. You want to treat something effectively, find it fast, period. Dental disease, a wound, a broken something, any of that. The faster you get it and can begin to repair it, the better your prognosis is going to be long term. Now your question was about internal imaging, or internal injury, I'm sorry. I'd say even more so important there. When I hear internal imaging or injury, I'm thinking heart and lungs, or I'm thinking liver, spleen, kidneys. I don't want any of those things to have problems. So the sooner I can diagnose that, and immediately when you ask the question, I'm thinking bleeding into the abdomen, bleeding into the chest, those kind of things. I don't have to explain why that's important to get diagnosed and treated as fast as humanly possible, because without that, I mean, it can be treacherous for a cat in that situation. So yeah, absolutely, early detection is paramount. And some of these modalities, usually X-ray and ultrasound is what most veterinarians have at their disposal, but those are invaluable for cases such as that. So, okay. All right, guys, that does it for this segment. Thank you for tuning in. If you have any questions, reach out to us. You can catch us on Facebook, you can email us, or you can just call us the old-fashioned way, and I'll be happy to answer any questions you have. Thanks for tuning in, and we'll talk to you soon. Bye-bye.